Welcome everyone to the July 2025 NAIOP Breakfast Program. I'm Matthew Hoyt, and I have the privilege of serving as your chapter president this year. Good morning to everyone in attendance here at the Orleans and to everyone joining by Zoom. For all of you that are here in the room, you'll find notepads at your tables. Please write down any questions you have during the program, and Dan Tuntlin from the Programs Committee will collect them for our Q&A session, which will wrap up the program from 9 o'clock to 9:15. Today we have very special guests in our audience. I'd like to recognize our elected officials in attendance today. Please stand and be recognized. City of Henderson Mayor Michelle Romero. Michelle, are you here? City of Henderson Councilwoman Monica Larson. Monica, thank you for being here. And City of Henderson Councilman Jim Seabuck. Thank you, Jim. We also want to recognize our UNLV students attending today. I'm told we have 7 students in attendance. If you're a student, please stand and welcome to NAIOP. Everyone, please take the time to introduce yourself to the students today. They'll have a green ribbon on their name tag. They are the future of our industry. This year, NAIOP's National Conference, CBRE Converge, is in Toronto, Ontario, Canada from September 8th to the 10th. Get connected with the entire commercial real estate community, industrial, office, mixed use, multifamily, and more with networking, education, tours, and special events. Take advantage of early bird registration before July 31st. You can register online at NAIOP.org. Again, July 31st, early bird registration. Let's take a moment to honor our current President's Circle sponsors. They're a critical component to the success of our chapter. This year we have 5 platinum sponsors. A special thank you to each one. City of North Las Vegas, a new platinum sponsor this year. Cox Business has supported our chapter for 21 years. Gatsky Commercial since 2022. Martin Harris Construction since 2001. And Schnitzer Properties since 2000. We also want to thank our 9 gold sponsors: Burke Construction Group, Clark County Community and Economic Development, EBS Realty Partners, Heller Companies LLC, Howard Hughes, Kimley Horn and Associates, Majestic Realty Company, Prologis, and Southern Nevada Water Authority. Thank you to our 9 gold sponsors. Now, please check out the screen as we recognize our silver sponsors. Our bronze sponsors. And our copper level President's Circle sponsors. And I'm still happy to report that our President's Circle sponsorship has reached an all-time high in 2025. If you're currently not a President's Circle sponsor, it's still a great time to join. If interested, please stop at the registration table for a package. You can talk to myself, Lisa Brady with Prologis, Katrina, or Jana. On to our committee announcements. May I have representatives from Bus Tour, Community Service, Education, and Membership Committees to the mic, please.
Good morning, everyone. Morgan Elson with Colliers. I'm here on behalf of the Bus Tour Committee. The 2025 bus tour will be held here at the Orleans Thursday, November 13th. This year we're going to have Willy Wonka theme, so searching for the golden ticket. Property submissions have been closed. Thank you to everyone that did submit your properties. We had a great turnout this year. There are still some sponsorship opportunities left. If you'd like any information, please feel free to reach out to myself, Jonna Savage, or Mike Wilmore. Thank you.
Good morning, everyone. My name is Roberto Gonzalez with UES and also part of this year's DLI class, which I've heard is the best DLI class in the history of NAIOP. I'm here on behalf of the Community Service Committee, and we're very excited to be collecting donations for our annual back-to-school supply drive in support of Hollingsworth Elementary School's STEAM Academy. The supplies we collect will help support students and teachers throughout the entire school year. On the screen behind me, you'll see a QR code linking to our Amazon wish list for a quick and easy way to donate directly. At the end of today's breakfast, you can also visit the community service table near the exit to pick up a supply list, learn more about the event, and ask any questions. Donations will be accepted through August 14th, so there's still plenty of time to shop for supplies. We have a few convenient drop-off locations, and make sure to stop by the table to grab a flyer to get those details, or reach out to any community member. Thank you again for your continued support.
Hi, I'm Jerica Doe from Monero General Contractor. I'm also on the Community Service Committee, which is why I was pointing towards the table, but I'm here for education today. Coming up on August 8th, we are going to have a members-only education seminar. It's a legislative deep dive for the 2025 session. That's going to have complimentary registration for members only. It is a $25 non-cancellation fee if you do not attend after signing up for it. This is a really great opportunity to learn how NAIOP was representing us up at the legislature, what bills passed, what bills didn't, what we can anticipate in the future, and just a great way to look at how we're getting involved as a commercial real estate community to try and make sure that the laws continue to promote and favor our business. Thanks.
Ryan Holden, the Concord Group, Development and Construction Consultants. I'm here for the Membership and Social Committee. Bowling, August 13th, coming up at the Orleans. We still have 10 teams available, so we're almost sold out. Sponsorships are completely full. The next one up is the social event of the year, Chicken and Pickle. We've got different sponsorship packages available there if you're interested in sponsoring. Also follow the QR code for the rest of the details, but hope to see you at both.
Thank you to our committees. Each month, we like to recognize our new members. If you're a new member, please stand and welcome to NAIOP. Everyone, if you see a red ribbon on the name tags, please be sure to welcome our new members. I'm happy to report that we were ranked as the 9th largest chapter in NAIOP, currently 743 members strong. A quick thank you to our membership committee for continuing to tout the value of NAIOP membership. If you've never been a member, now's the time. With over 290 in-person attendees today and continued record attendance at our events, the networking benefits of being a NAIOP member has never been better. There are a few ways to join. You can stop at the registration table up front for an application. You can visit our website and join online. You can call the NAIOP office, or you can reach out to anyone with a membership committee ribbon on their name tag. Now we'd like to thank our 2025 breakfast meeting sponsors: American Nevada Realty, Carpenter Sellers Delgado Architects, City of North Las Vegas, Cox Business, Martin Harris Construction, NV Energy, Panettone Development, Schnitzer Properties, Southern Nevada Water Authority, the Whiting Turner Contracting Company, and our Wi-Fi sponsor, Gatsky Commercial. Thank you to our breakfast sponsors this year. And a special thank you to this morning's meeting sponsor, the Whiting Turner Contracting Company, who is also a silver level President's Circle sponsor. I'd like to call John Brewer, Hospitality National Leader, to the stage.
Good morning, everyone. As said, I'm John Brewer. I'm one of the vice presidents in the Las Vegas office for the Whiting Turner Contracting Company. On behalf of Whiting Turner, I would like to sincerely thank NAIOP Southern Nevada for the opportunity to sponsor this morning's event. Our local team is proud to have been part of this community for over 35 years. Working with the wonderful developers that sit in this room, the talented design teams, the great jurisdictions that are very supportive of the work we're all doing. And we just appreciate them and all the trade partners that we work with to make sure that all the projects are successful and that we can help develop this community. In particular, given the panel topic, we're honored to have played a role in advancing local health care, building facilities like the Cleveland Clinic Ruidl Center for Brain Health, the Southern Nevada Public Health Laboratories, the Optum Henderson Consolidation Clinic, Optum's Charleston Cancer Center, among quite a few other projects for our local partners. None of this obviously would be possible without the trust and partnership that we have developed with our developers, trade partners, and all the wonderful partners that we have in the room today who share our commitment to excellence. Thank you for all we've worked alongside with and for allowing us to contribute to the growth and well-being of Southern Nevada. We look forward to continuing to build together for the next 35 years and beyond. If you need any additional information, feel free to stop by our table after the event. Thank you.
Thank you once again to the Whiting Turner Contracting Company. As you all know, our programs committee has been putting out the best programs in the business. One of the reasons our programs have been so great is the audience participation. This is one last reminder. We have a Q&A session at the end of the program for our in-person attendees. There are pens and paper at your tables, which will be collected. Q&A will start at 9 o'clock, and our program will conclude at 9:15. And once again, I just like to tout the strength of our programs committee. Having 290 people in the room in the mid-July program is absolutely amazing. It's just fun to be a part of this year, so thank you all. I'd like to segue into today's program titled Taking the Pulse of Southern Nevada's Healthcare Industry, and I'm pleased to introduce our moderator, Dan Palmeri. Dan is a senior vice president with CBRE, specializing in office occupier services in the Southern Nevada market. He has over 17 years of commercial real estate experience providing tenant representation, leasing, and sales advisory services for some of the most prominent corporate clients, business owners, and federal and state government users in the market. Dan has been responsible for leasing more than 8 million square feet of office space in the Nevada market, as well as over 500,000 square feet of facilities nationally and internationally. Dan is an active member of the SIOR. Hey, almost there, Dan. I didn't get to the best part yet. Dan is an active member of the SIOR Southern Nevada chapter, building strong relationships within the business community, both regionally and nationally. He's an active member of local Las Vegas community, working with the Shine a Light Foundation. Prior to joining CBRE, Dan was managing director at Cushman & Wakefield. He's been a longtime NAIOP member over the years, and I had the pleasure of meeting Dan and participating with him in the 2010 DLI class, which actually is the best class ever.
Thank you.
Welcome to the stage,
Thank you.
Dan.
We're going to fix that one. That's good morning, everyone. That's way too long. That's it? My turn? Well, good morning, everyone. Welcome to the Orleans. 7 a.m. crispy breakfast and coffee is my favorite. I'm Dan Palmeri with CBRE. I'm excited for today's panel. But before we get into it, most of you know, some of you don't, our community lost a great human being last week unexpectedly, Melissa Campanella. This is life, right, guys? So I'd like to just take a brief moment for a moment of silence for Melissa and her family, if you guys don't mind. Thank you, guys. Appreciate it. I lost my dad unexpectedly almost 6 years ago, so for me, every day is a blessing. I truly lead perspective in life that today, this could be my last conversation, right? So seeing stuff with Melissa, it's a reminder that we can get squashed at any time. So have fun, enjoy the day, enjoy the conversation, and try to do it with a smile, everyone, right? So switching gears, let's talk about healthcare in Southern Nevada. We're crushing it, right? According to the 2025 Commonwealth Fund scorecard, we rank in the bottom 10 for healthcare systems performance. No shock there, but I was thinking about this morning, we're still a very young city, right, guys? Like, our first high-rise was built in 1975 by Irwin Molaski. We are a young city. We're still figuring this thing out, and I think what's cool with living in Southern Nevada is we are all actually involved in the true growth of this community. So with that, I think we're seeing some change happening. Healthcare providers, developers, and investors are stepping up to meet the moment. There's new hospitals being planned, new outpatient facilities. As you know, I represent a couple of healthcare providers, and it's the busiest stuff we're working on. So it's good to see the momentum moving forward. We got to work on our nurses and our doctor numbers, but we're slowly getting better in the numbers, you guys. So today we brought together a panel of leaders who are not just talking about the future of healthcare, they're building it. So I'm very excited to introduce three amazing professionals. I'm going to start off with Larry Barnard. Larry is the president of the upcoming Nevada's first standalone children's hospital. Thank God. That's going to be built by Intermountain Healthcare over at the UNLV Tech Park. Their lease just got signed last week, so I know they're going to be moving pretty hot and heavy on that site. Larry, not only having a better beard than myself, is a West Point graduate and U.S. Army veteran, so thank you for your service there. He's held top leadership roles at UMC and Dignity Health. Come on up, sir. Next up, we have Jeff Ruidl. He's a senior vice president at Hammis Partners based in Milwaukee. Pretty interesting company. They focus on acquisitions and developments of MOBs, medical office buildings. So it's be pretty cool to get a national lens on how Vegas is performing in relation to across the country. Jeff, please come up. And lastly, Bill Warr, licensed nursing home administrator with Green Valley Health and Wellness Suites. He's had a career focused on overseeing skilled nursing and post-acute care facilities across Nevada. Bill is on the front lines of long-term care, managing the realities of an aging population and the need for high-quality recovery environments. Bill, come on up, sir. The excitement in this room is overwhelming. All right, we're going to kick it off with the big elephant in the room, Children's Hospital. So the vision for healthcare in Nevada, Larry Intermountain's making a bold move with the Nevada's Children's Hospital. What does this project represent for the future of healthcare in our state, and why now?
Yeah. First off, I want to say thank you for allowing me to do this. Most people don't want to hear me talk, so it's very exciting that I can speak about what's happening. This has been a 40-year journey, and a lot of you have been in here, have seen several attempts at doing this. In fact, I saw a couple of people in here that helped us actually get this done this go-around. The reality is that when was the best time for us to build a children's hospital? 40 years ago.
Yeah.
And when's the second best time? Today. And that's where we're at. We have so many kids that are leaving the state to get care. And it's not even just like tertiary high-level care. Some of it is just some basic things that they don't have access to. Or I'm sure a lot of you that have kids or friends that have kids, they're saying it takes 6 months to get into this. Or, one of the things that we have a really hard time in this town doing is autism diagnoses. Those can take from 2 to 3 years. So think about being a parent and not know what's going on with your kid for 2 years and not having an idea of how to help them. And in those 2 years, which is usually the most formative in terms of that kind of diagnosis, you're waiting. And so Intermountain, so I joined Intermountain for this project specifically because it is going to be the largest investment in healthcare in recent past, and it's going to make the most impact for people. If this were a financial decision, I'd say this is horrible. Why are we doing this? PEDS is not where you make money. PEDS is not where you get a lot of ROI, but it's the right thing to do. And that's why I want to be with this company and decided to come on, because they're really trying to make a difference here. And what I'm hoping, and I think a lot of people are hoping, is that this will be the first of many investments in healthcare that will help. We have a lot of great things happening in this town, right? There's a lot of great healthcare providers here, a lot of good doctors, nurses. What we haven't done is integrate them all into one kind of platform, and we're hoping this will be that integration for PEDS. And as that happens, we hope other people will say, well, if we're getting this here, why aren't we getting it in this area and in this area? And then we'll start to see that growth as well. So,
In regards to gaps, you talked about the timing to get appointments, et cetera. What's the biggest gaps in care of infrastructure you're seeing today?
What's going to be difficult is what's not here, what does not exist here. And I'll give you a good example. There's one pediatric neurosurgeon in the entire state of Nevada. So that's covering Reno, that's covering Vegas, and then any kind of outlying. There's one.
Wow.
Intermountain brought that physician here even before the hospital, because they just thought, look, we get so many kids getting sent up here, maybe we can keep them down here, let's send one. And it's at a loss, right? Financially, it is not one that pays for itself. And being with a mission-based group like Intermountain, where it's really about how do we take care of the community, how do we keep people there, it's just a different feeling, and it's something that I haven't really had that much in healthcare. And we look at neurosurgery. There are no board-certified practicing pediatric ENTs, ear, nose, and throats. So if there's someone that needs to figure out an airway, so as a town, to your point, we're young. We've been able to patchwork what we need to move forward. And like I said, there are areas like cardiology that are just nationally recognized, but then there are areas where we have no one. There's one person in the state that can diagnose autism.
That's crazy.
And so when you add up all of these little things, now all of a sudden you've got a big gap.
Yeah.
And so the next couple of years, I was like, oh, once we get the hospital, that'll be the hardest thing we do is get this lease. And timing-wise, it took forever. Now I'm like, wow, that was easy compared to how do we find the doctors that don't exist here with the same issues that we have in every other industry that comes in saying, well, I want to know about healthcare and I want to know about public health or public schools.
Yeah.
And so it's going to be an uphill battle. It's going to take more than Intermountain. It's going to take more than the people that support this project. It's going to take everyone in town to say, we need this, we deserve it. How do we get people to want to come here?
Yeah, so much like the surgeon, right? I mean, we gotta import them.
Exactly.
Yeah.
And right now we are not where we need to in terms of creating physicians
Right.
and nurses. And so not only are we in that deficit, but we don't have anything to sustain us as people start to retire out.
Yeah. It's exciting, huh? Wow. Let's talk about more exciting stuff then. Let's switch it up to investment and development trends, Jeff. From your national vantage point, what's so attractive about the space, and how have you navigated the changes in the capital markets over the past couple of years from an acquisition standpoint?
Sure. I mean, I'd say, first of all, it's great to be with everyone this morning. I certainly appreciate the invitation. So outpatient medical is really a tremendous product type. It's a little less mainstream than a lot of the ones that everyone in this room are probably accustomed with. I like to think that, I know that the O and the P in NAIOP does not stand for outpatient, but maybe this morning we can all just pretend that it does. So it's really that the space, outpatient medical, has generated a lot of institutional attention over the last 10 years. So we at HAMMIS have been at this for about 30 years, kind of solely focused in this product type. Putting some numbers to that, our firm has developed or acquired 84 million square feet nationally. We've completed over 500 MOBs, and we played a role in the development of 200 new or replacement hospitals. So on the investment side, we've raised and are in the process of deploying 5 institutional funds. So closed-end and open-end, and our last closed-end fund had about $725 million of equity. So we're a core plus buyer and developer of kind of outpatient medical product nationally. We love this market. I wish there was more for us to do here, and I certainly hope that there will be. I think we'll speak a little bit about that on the panel shortly, but that's definitely my lens on this panel. It's the investment side. We're buying, we're selling, we're developing, and then capitalizing other developers nationally. So we all know commercial real estate just generally is cyclical, and in the last 5 years have been pretty volatile. But outpatient medical has really been a star of the show when you kind of look at commercial real estate more generally. I think that starts with strong demand drivers. So the most obvious is demographics. And my team put together a few stats, which I think are interesting. So the age 65 plus cohort is projected to increase by 50+% by 2050 to 82 million people. And this cohort, the 65 plus cohort, consumes 3.5 times as much healthcare as those under the age of 45. So that's 5.5 physician visits annually and an annual cost of a little over $25,000. Larry can speak to this much better than I can, but that the health systems continue to be very cost constrained. It's multifactorial. Things I'd put a pin in are kind of the high cost of labor, reimbursements not keeping in place with inflation, and it's just difficult to find talent and retain talent. So because of that, health systems are always looking for the most cost-effective locations to deliver high-quality care, and that really goes back to outpatient medicine. 70% of the surgeries across the United States are now performed in an outpatient setting. This was 19% in the early 1990s. So growth over the next 5 years on an inpatient basis, it's supposed to be around 5%. In outpatient, it's going to be 32% projected.
Wow.
So it's definitely the push to outpatient, has been our investment thesis for a long time. We're continuing to see it nationally, and it's just been a great space to be invested in. Other reasons we like it, the tenants are very strategic in their locations. That's due in part to the expertise in this room, a lot of the local brokerage community that's kind of putting that retail type discipline and making sure that they're choosing the right locations for the delivery of care, looking at demographics and kind of traffic patterns. The tenants also put a lot of money into their space. So,
Right.
When we're looking at investments, we're able to underwrite 90-95% retention ratios, which is just very atypical, compared to a lot of other product types.
Yeah, I think that's the one thing with healthcare, right? They understand they're putting hundreds and hundreds of dollars a square foot above and beyond any sort of allocation a landlord is going to give them. And so walking away from that space, after a lease expiration's much less unlikely.
Yeah, I'm working on a few transactions now where the landlord is putting in $150 a square foot for new generation space, and kind of the physician tenants are putting in over $250.
Yep.
So it's a really significant out-of-pocket impact, and we'll talk about development probably later this morning, but that's an opportunity and a frustration that we're kind of feeling kind of in the development space with.
With your national lens, though, how is Southern Nevada compared to the other markets you guys are focused on today?
Yeah, I would say, Southern Nevada, you have a top 30 MSA, strong incomes, population growth, job growth, an increasingly diversified economy. Again, it's a place that, Hamas and kind of all my competition would really love to invest. All of your medical office buildings are performing extremely well.
Yeah.
It's like 90, 91, 92% occupancy. Comparing it to other markets, you have very limited new purpose-built facilities. We're starting to see a few. There's a tremendous developer population here. But there just hasn't been kind of that new growth and purpose-built MOBs that we have seen kind of all throughout the country, which I think is a frustration of mine on the investment perspective, trying to acquire buildings nationally, but a huge opportunity, for the developers in the room that, might be looking to put new product. I think that there's a real dearth of product that, if you get those projects done, groups like us will be all over it to take those down.
It's a good thing we have plenty of land available, so it should
Okay,
be no
good. Yeah. It's always helpful to know. I mean, Larry hit on it a little bit. I think that you have a real significant undersupply of healthcare talent here.
Yeah.
One of the stats that our team found is that you're 48th out of 50 in terms of primary care physicians per capita. So I don't have the expertise to understand exactly, or the local knowledge to understand exactly why, but it's something that I'm sure we'll spend more time on this morning, and it shows you a real opportunity for continued growth.
Yeah.
Kind of within Las Vegas.
I always wonder when we say like we're 48 out of 50, but then sometimes we're 51st. That makes no sense to me. I don't get it. We're going to switch gears over to Bill. So Jeff mentioned the drastic increase in seniors. I saw a stat yesterday. Every day there's 12,500 new people turning 65, which is kind of crazy, right? And so most of us kind of have a very broad understanding of senior and acute care, but don't really experience it until our grandparents or parents start to need those services. Bill, can you kind of give us a little bit of breakdown and understanding of the different aspects of your industry?
Thanks for having me. I appreciate being here, and I probably have the least exciting forum here. So I've been here 55 of my 56 years, so I've seen Vegas change, and I honestly didn't know nursing home from motorhome probably until I got my license. I didn't get my license till I was about 40. So and it was a pretty rigorous process, and I didn't really understand what that meant, but there are a lot of regulations that go into it, and probably like you, I mean, I was watching a Hallmark movie when I was younger, or you went to nursing homes and did Christmas carols when you were a Boy Scout or Cub Scout or something, but the nursing homes now have very sick patients. So probably 10 years ago, we didn't have enough nursing homes. I don't necessarily know where we're at from a volume perspective now, but it's a very changing environment, a very difficult environment. I can talk about reimbursement. I mean, I can talk about it, and we will get into that a little bit more, but you really don't think about my niche until you need it. I'm almost there where I need it. My parents are obviously at that age, and I kind of cringe because even though I run a pretty good nursing home, I really don't want to go there. But it is, my building, for instance, is a mix of about 50% long-term patients where that is their home, and then I've got about 50% skilled patients. And we are privileged to be in the Henderson community. I heard that the mayor is here, so thank you. So I'm on Wigwam Eastern. We have about 20 open beds, so whoever wants to join me this afternoon. But it's a very challenging sector. Everybody thinks that Medicare or commercial insurance pays for their full stay. Certainly they will pay for your quote-unquote skilled portion of that stay, but many patients are obviously not ready to go home or don't have a home to go to, and they have to depend on the Medicaid piece, which is a difficult transition. If you can make that transition, or it becomes a private pay situation, or you might have another insurance option. But it's a very difficult environment, and one that you don't think about until you have to. And some of the upcoming political changes are going to make it even more dynamic. So we can talk about some of the community needs. I just know that my game is most likely going to change. I provide a very good service. All the nursing homes provide a very good service, but I think that their formula financially and operationally is going to have to change. So.
Interesting. From a facility standpoint, do you think we have enough currently to meet today's needs locally, or are we at a deficit?
So from a statewide percentage, we have around 67. So we've got about 7,200 beds, about 80% occupancy. So I don't necessarily think we're in a position where we necessarily need more beds now. I couldn't say that 10 years ago. I ran 15 of them here about 10 years ago, and then left the industry for a bit. But we needed we needed nursing homes then, but probably 10 to 15 have popped up in that time period. So we're in a much better position now. I think we're going to need more nursing homes. I just don't necessarily know what that's going to look like, and necessarily if the same type of services are going to be needed. I mean, the long-term portion makes up a huge percentage of not only my building, but all of the nursing homes out there.
Interesting. We're going to switch back to kind of construction and cost a little bit. Mostly Larry and Jeff on this one, since you're on the development side. How are you navigating the rising construction costs, labor shortages, and interest rates?
Yeah, not very good.
You and me both.
Yeah, we thought we knew exactly what we were going to pay, and then obviously the tariffs came and people just started throwing out percentages, and now the project's ballooned and we have to figure out what that's going to look like. So yeah, the construction side is, and that honestly is, we're not building hospitals all the time, right? And so it's not like I have an expertise to be like, well, this should actually be this. You're all the experts, and it's like when I go to the mechanic and they're like, hey, you need $10,000 worth of work, and I'm like, that sounds right, I guess. Like, I have no idea what that means, and so when I get this children's hospital, we're like, this is the real cost.
It's a cool billion, right?
Yeah, and I'm like, for $1 billion, this should look like, in my mind, like Raider Stadium.
Yeah.
And I don't feel like the hospital is going to look like Raider Stadium. But I think, luckily we have a lot smarter people on the team that can work with.
Well, I've learned it's got more walls and sinks and stuff. So, walls and sinks and toilets are expensive.
That's a good point. And especially for little kids, because it's so niche, everything, you would think it'd be less because it's smaller. It is like 3 times more because you don't need that many in the world. So, yeah, construction's been a little bit of an issue in terms of just that costing.
Yeah.
But we're really far along. We're starting systematic design, which basically is on the land we're building for. I'm sure you're all like, yes, I already know that. But systematic design where we're building on the land itself. And so, we've got a construction company that we talked about last week in the paper. So we're really far along. We're hoping February of next year is the groundbreaking. And then 2030 is when we open doors, is what we're saying. So
awesome.
Seems like a lot of time, but turns out it's not.
It goes quick. Goes real quick. Jeff, let's get into the capital market side of things. Healthcare, I think, has really been the darling for the last 5 years, regardless of segment. Where are cap rates now today versus where you saw them just over the last 2 to 3 years in that industry?
Yeah, so I would say for the chorus of core product that we're seeing nationally, cap rates are now kind of dipping back into the 5s, which is very helpful and great to see. It's been a few years, but we're glad to see 5s back. The vast majority of the product is kind of in that low to mid 6s, and again, that's for Class A product, and then the Class B and below. That's kind of high 6s to 7s. I think this is fueled in part by there's a lot of investor demand. Again, these are office tenants that have they have good capacity to pay their rent, and they oftentimes have long-term leases. So there's a lot of the fundamentals behind a lot of these projects are very strong, and they kind of on the debt capital market side, they're good collateral. So we are seeing lenders coming back and and aggressively competing to win those debt pieces, which help fuel investments throughout the country.
Awesome. Let's dive into the future of what spaces look like. Bill, you kind of touched on this a minute ago. Where do you see medical office, acute care? How are patient expectations, technology shaping the design of these new facilities?
Well, from a post-acute perspective, I mean, my buildings have been very, traditionally they have looked poor. That they've looked like old apartment buildings.
Yeah.
Now, I have a beautiful building. I mean, aesthetics is probably key. I have a nice modern building. It's 2-story. I wish it was 1-story, but we obviously didn't have the real estate, so we had to go up. But my residents now, they are more concerned. Obviously, the number one priority where are my pain meds, which I can't control. I don't write scripts. So, but number 2, they want to have good activities, they want to have good food, and they want a beautiful building. So really, I mean, the new builds are very innovative in how they're built. They're very, very clean, have a lot of open spaces for activities, and then therapy is key. So I have a very large therapy gym, open windows, and lighting is very important. So there are a lot of nice new ones, but unfortunately there are a lot of old ones that provide good care, but just can't compete from a marketing perspective.
Yeah, anytime I visited my grandma, I had to bring her food because salt
Right.
was amazing. She never got salt at the facility.
Well, I've known Larry for years, and when he was on the other hospital side, he never, his team never did a good job of preparing them, transferring from the hospital to my facility, and that transition is difficult at times. So yes.
I'm
Thanks,
sure
Larry.
it is. Larry, we're building $1 billion hospital. Technology, especially with AI, is like just flying at us at a crazy rate. What are you guys planning for in the way of new technologies in this facility?
Yeah, this is, so you would think that tech in healthcare was really good. And the reality is all the money is put into the clinical side, and then tech is a secondary. Because this is a children's hospital, we're making it, all of our kids are better at tech than we are, honestly. Like, they can hack government files already. Like, it's just, so we have to have that tech up where, we're looking at building, every room will have an Xbox. They're all wired together. They can play tournaments together.
Cool.
We're gonna have the ability to broadcast to all of them. So you can imagine there's a lot of celebrities that wanna come in and be able to talk to all the kids. We have a podcast type booth where they can talk to the kids. There's a lot of interactive things that we're looking at. It really, what we're trying to do is protect childhood.
Yeah.
The last place a kid wants to be is cooped up in a hospital. And so we're trying to find innovative ways so that, maybe this one child can't leave their room, but can we bring something to them? And then those that can leave, how do we create an environment where they can still try to be kids? And so it's one of those things that it has to be at the forefront, because it's very easy in healthcare to be like, all right, that costs this, what's the ROI? 0, then let's move on. And
Right.
when it comes to kids, it's, look, if it's gonna make their lives just a little bit happier, let's invest in it. And so, yeah, we're looking at some tech that hopefully will be, I don't think it'll be cutting edge, let's be honest. It's gonna be like the edge, maybe not the cutting edge, but the edge. Because I don't want to really put a lot of stuff in there that nobody's ever done before and go, yeah, none of this works.
Yeah.
Because I've been in you've all been in buildings where you're like, well, this thing's supposed to interact with you, but now it's just a wall, and we put some plants in front of it. I want to make sure everything has a purpose and works really well. So
100%. Well, I just think the gaming aspect of it with them and being able to create tournaments is a wild concept.
We're
cool
looking,
future.
we're setting it up so that we can play against other hospitals too, so
Wow.
that we can be like, we're better than you. Our kids are.
That's fascinating.
But we also looked at potentially building it in, offline so that like families can play with them and connect. And what's cool is if they log into the account, if they already have one, they'll manually get deleted. And so it's not like starting from scratch. But it's going to be better than if you've been on an international flight lately and they have those TVs and you can play 4 games like checkers and chess, and it's going to be way better than that. I'm going to just, I'm not going to say how much better, but it's going to be way better.
I was playing poker with a passenger like 1 seat over, and I could see his hand the whole time. It was like, it was so
just
good.
watching his cards.
Flawless.
Seeing
I
his
took
cards.
all his fake money. All his fake money. We're good on time, yeah? Time? Sweet. Let's dive into everyone's favorite topic, Medicaid and Medicare, right? No? Bill and Larry, this is focused on you. Bill, we'll start it off. Medicaid currently covers about 800,000 Nevadans, including 60% of nursing home residents. How might these funding changes affect long-term care infrastructure, and what role can the private sector play in mitigating the impact?
I don't know what role the private sector can necessarily play. I mean, we can probably talk about that. You have better ideas than me, but Medicaid is obviously extremely important to my building. Like I mentioned before, I'm actually incentivized via the supplemental tax break that I get. So I'm incentivized to stay above 65% capacity from a Medicaid perspective. So totally watch that number because it penalizes me incredibly. I wouldn't be in existence without that Medicaid population. Now, the Medicaid reimbursement, that's a totally other subject. The daily Medicaid reimbursement is probably between $200 and $225 a day from Medicaid, where it's about $750 from Medicare, and then the commercial plans vary. So economies of scale. my building provides an option where once they get quote unquote better and they aren't necessarily skilled, there isn't this rush to get them home. So they transition to long-term care, and typically that becomes a private pay if they don't have that Medicaid option, but typically it becomes Medicaid, but they aren't that patient isn't a hot potato that it would be in a building that just tries to service a higher level skilled patient. So I need both. If some of these changes go through, it will decrease or eliminate the supplemental help that I get, and I will probably still be in existence, but my world is going to look a lot different. Some of the buildings that I work with that are in the same portfolio of mine are even 80% Medicaid. So those buildings, and they don't have a lot of options. I mean, some of these buildings don't look good, and they don't have a lot of the new cutting edge stuff. I do.
Yeah.
I can probably pivot some. Some of my peers can't, and so when I say that, I mean, there's still going to be that need. I just don't necessarily know what that need's going to look like and who the payer is going to be, because very few of us have money to tackle this from a private pay perspective. So if the Medicaid help goes away, so my subject is not entertaining. I don't have the kids to talk about and stuff, but all the kids become adults and become seniors.
They're back in diapers. Come on,
man. It's a problem. Yes,
right?
I'm pretty close. Yeah. My staff act like kids. I don't know. Yeah.
Yeah. Larry, do you guys see the effect of it at all on the Medicare Medicaid side?
Yeah, it's huge. It's kind of like, I know that you probably in your life have talked to your parents about schools, and some of them are like, why do I care? I don't have kids. You guys are grown up. It shouldn't matter. It doesn't affect me, but it does, because having those schools there put out, educated people, new workforce, they keep kids off the street. Medicaid has that same impact. So unlike you getting sick yourself, if you take the day off, it's fine, most of the time. But if your child is sick, they're sick, you have to take the day off, and then if you're in a household that relies on two incomes, now you're in a deficit, and it just keeps going. Yep. And with this Medicaid change, it's going to create more people who are underinsured or non-insured. So you have this group of Medicaid people that the government is taking care of, and mind you, the payment rate is not the best. It's just enough to get by. But then you have commercial. Well, there's a gap of people that don't have access to that, and a small piece that can't get anything. Yeah. And those are the people that ultimately will still need care and still need support, and then that gets distributed across all of the people that come in, that lack of insurance. Yep. And so it's one of those things that it's very easy to step back and go, well, I don't have Medicaid, it doesn't affect me, it's not a big deal. But if you have any employees that are on it, if you have any people in the community that are on it, it's everyone's issue. And so that reduction in those people that'll be eligible, the payment structure is changing, and so that'll be a lot less, is going to be a big deal. And so, especially for a group like this, it's kind of the argument with Vegas, we need better schools and we need better health care. That's how we're going to attract new companies, how we're going to do it. Yep. You guys have a very strong voice, and the more you advocate for these kind of programs that might not feel like they directly touch you but impact the entire community, that's really how you can help get that voice out and hopefully change it. There are already hospitals that have closed because of that bill that just said we can't make it financially, we're done. So there are rural hospitals now that don't exist, and those people still need to have care. They're not going to just stay in their city and just bleed out. They're going somewhere. Yep. They're coming to major cities. And so it affects a lot more than the 800,000. They're directly affected, but the rest of us are going to be a part of that. And so we do need to make sure we do what we can to sustain it.
Yeah, wild times. I saw Mr. Tuntlin walking around. Sir, do you have a bevy of Q&A for us?
We have a couple, Mr. Palmeri, and then you can probably close it out if you want.
I don't want to.
First, I'd like to report that our very own Matt Hoyt, President Matt Hoyt, just got back from running with the Bulls in Spain, and he did not need medical care. And thank you, Mayor Romero, for joining us today. One of the questions is for Larry. How will pediatric research be prioritized?
So that is a big part of what we're doing. Academics is going to be imperative because we have to grow the next generation of physicians that will stay here. We see a lot of either kids leaving to go be doctors in other states, and they usually stay where they're at. The research component of that will be tied to academics, so we will be doing a lot of the cutting edge medicine necessary to move medicine forward. And so we will be aligning academically with UNLV, potentially UNR, Roseman, Touro, all of those. And we're not going to be exclusive to one group because there's just too much going on and too much of a need to collaborate that we're bringing everyone together for that research part.
Thank you. Bill, can you explain the difference between nursing home, skilled nursing, assisted living, independent living, and long-term acute care?
No.
Next question.
Perfect. Maybe Mr. Palmeri.
That was like 4 questions, and I didn't think I was going to get any questions at all. My God. So long-term acute care. I mean, I would have to say that probably. So I butt up against an LTAC, which is actually kind of a step more of a direct step down from a hospital, and that's where you have some really sick patients that are on ventilators and so on and so forth. And then you have the skilled nursing facility. I would kind of consider those long-term acute care. Long-term care would encompass kind of the assisted living and any group home living or any healthcare needed at the house. But a skilled nursing facility. So when I talk about being from a skilled perspective, you are considered skilled based upon therapy needs, IV needs. Certain medical needs. Once those aren't necessarily needed any longer, it doesn't necessarily mean that your loved one or you are ready to go home. I mean, that could be a huge step. So my building can kind of bridge that gap. Assisted living has some nursing help. I wouldn't consider it long-term acute care. They have more CNA type help. Caregiver type help. It's still needed help, but it's not necessarily long-term acute care. And then the group homes and then home health. That's a kind of a different animal. But we work in concert with all of them. But the long-term acute concept is probably more for the LTAC, more kind of how would I term it? More nursing homes. But there are a wide range of sick people in those buildings, and then it graduates kind of to assisted living and group home.
Mr. Palmeri, before the breakfast, I was the bookie on the over-under before what time you had mentioned food, and we lost. You waited till 8:41. So the question is, we all had 8:30. What is your favorite restaurant in Las Vegas? It doesn't have to be next to a hospital.
No, yeah, my favorite, like most people don't know about it, is called Bahamar. It's on Las Vegas Boulevard in Oakey, kind of butts up to Lovett's Frozen Custard. It's a little sketchy parking around there, but the food's amazing. Got to push a buzzer to get in, if that helps you. But the best Mexican seafood tacos and tostadas, off the charts. Just south of the Arts District. So right now, that's Bahamar's kind of number one right now.
Thank you. And then so far, unless the audience has any more questions, we'll let you take us home, Dan.
Well, I just want to point out, I get people out on time. Thank you. Thank you. But I want to thank our panelists today. I know healthcare in our community is a major subject matter, frustrating as hell. But I think the Valley's growing rapidly. The healthcare system and industry is working feverishly to keep pace. And so it's exciting to see something magnificent happening with the Children's Hospital. That's just so promising for us. So Larry, Jeff, and Bill, I truly appreciate your time today. Everyone, thank you for coming out today. Drive safe, have fun, don't forget to smile. Thank you, guys.
Thank you.
Thank you guys for an excellent panel. I want to thank again the Whiting Turner Contracting Company for sponsoring this morning's meeting. And to all of you here in attendance today, thank you for coming in the middle of the summer. We'll see you again on August 21st at our next breakfast program. Thank you so much.